It is a video to demonstrate the clinical interpretation of scapulothoracic rhythm, or some people call it for humorothoracic rhythm. Okay, these are identical terms. For the lifting up of the shoulder elevation, it involves the glenohumeral joint and the scapulothoracic joint. Throughout this 180-degree shoulder elevation, the first 0 to 60 degree is a purely glenohumeral joint movement, initiated by the supraspinatus muscle and then continued and reinforced by the prime mover, the lateral deltoid muscle. So the rotatory axis here. Then from 60 degree to 120 degree, the scapula start to involve in the scapulothoracic rhythm. So then the rotation axis shift from here to here. Then the scapula start to rotate. In this position, the serratus anterior start to turn the scapula, and then the mid trapezius and the lower trapezius stabilize the scapula, avoid excessive tilting out, excessive protraction. From 120 degree to 180 degree of shoulder elevation is a further scapular movement. The rotation axis is here, the top of the angle of the scapula. Okay. In here, this angle, the upper trapezius try to help to elevation of lifting up the shoulder so the scapula can lift up further, and the serratus anterior activate much more to lift up. So what is the common impairment is that for the 100 to 120 degree, either the middle trap is inactivated, then the shoulder excessive protraction, okay, so then it causes the shoulder pain, more excessive pressure on the glenohumeral joint, or the serratus anterior here is not activating, then the lacking of shoulder rotation, scapular rotation, they also increase on the pressure here. And then at the end, after the rehab injury, usually in the late stage at 120 degree to 180 degree, is the inactivation of the upper trap or inadequate stabilization of the lower trap, causing imbalance of the upper or the lower part, also the shoulder not fully lifting up. But this scapulothoracic rhythm is to test out for the movement kinematic impairments. It doesn't give the specific medical diagnosis. For medical diagnosis, you still need to go through the clinical reasoning and clinical pattern. But in this way, we do this observation to observe the movement impairments.